Our teens are facing an unprecedented mental health crisis, and parents are on the front lines helping their teens adjust and cope with the COVID pandemic. We're continuing the conversation with Bethany Eigel, Virginia Cooperative Extension 4-H agent. Thank you for sticking around with us.
Sure. Thank you so much, Kianna.
Yeah, let's continue with what are some of the signs of distress, things that everyone should know, not just parents, and the protective factors we can use to help.
Yeah, absolutely. So, anxiety kind of feeds on itself. And so one of those telltale signs is excessive worrying by your young person. They're more worried than usual about things that they've normally handled okay, such as school or their friendships, other activities that they're involved in. They may present as more irritable or moody. And again, I know that's hard to sometimes tease out because some of that is normal behavior for a teenager. But if you can have a baseline for their behavior, and each teen is completely different in personality, but try to sense, are they getting more angry more often, or does their anger spill over and they can't seem to overcome that anger? It's going on for several days, or it's very intense in nature. That can be a sign for sure. They can start putting things off that normally would be important to them, or they could easily see through certain tasks that they've completed in the past with no problem, and now they're just putting it off as if it's not important and it's not a priority. Things like school and home and their family responsibilities, they're just neglecting them altogether. They don't seem to have that drive anymore. Appetite changes. Eating more or eating less than normal can definitely be a sign, and the same would go for your sleep patterns. If you can try, I know it's hard, but to track the teens' sleep patterns. Some are night owls and some are morning people. And if that drastically changes, where they're sleeping in really late when normally they would be up by 7, that can be a sign. And it's over time, right? So we want to know what our teens' normal behaviors and patterns are, and try and clock those moments in which they're starting to regularly display things that are off track. So some preventative measures, these safety nets that we can build into a teen's life, are those that kind of protect them or shield them from feeling that they don't have a sense of purpose, and that they can kind of spiral and let that anxiety build and manifest in these kinds of symptoms. And that can be all sorts of different things. In school especially, they're so focused on their education, but sometimes we're not building those life skills that help them to simply deal with a setback, right? And so when we are faced with a ginormous setback, such as the pandemic, how are our teens coping if they have not been given those life skills? So plugging them in, even a sport, or being part of a chorus group, or something at their church, or with some clubs like 4-H, or any of those organizations in which they are also learning life skills and confidence. That is building resilience in that young person, so that when they face a setback in the future, they have the skill set to say, okay, I've been here before, I've overcome, and I'll overcome again. And so anything that a parent or an educator can do, in addition to those very important educational lessons that they're learning, to build and fold in those life lessons, is key to helping young people overcome challenges and be more resilient for the future.
Well, you have provided so much great information just in that one answer alone. I guess if you could answer in 30 seconds or less, how do we even, as parents, approach mental health of our teens if we do feel like there's a concern?
In 30 seconds, I can nail it with talk. Talk about it. It is the number one myth that talking about mental health issues or talking about teen suicide, it is so taboo in many households. But it is the number one myth that talking about it somehow plants a seed. It is actually it's the opposite. It can help to prevent something from going from ground 1 to 10, and preventing that teen from taking further action just by talking, just by listening, checking in. And if there is an issue, please reach out to a mental health provider immediately and get the team plugged into the resources that is going to help them to thrive.
Excellent. Bethany, this is so timely, so necessary to have this conversation. Thank you so much for putting your expertise into this conversation, and hopefully it will help a family that's watching this morning. Thank you.
Thank you, Kianna. Thank you for the opportunity.
Our pleasure.